Welcome to the Health Coach OT. I'm Dr. Jaclyn Schwartz, occupational therapist, scientist, and board-certified health coach. If you're a therapist ready to expand beyond traditional interventions, you're in the right place. This is where we explore evidence-based coaching techniques that address the root causes of chronic disease, from nutrition and exercise to lifestyle factors that truly drive lasting patient outcomes. Today, we're diving into what is exactly health coaching, essential knowledge for practitioners ready to transform how they approach chronic disease management. Let's get started. Consider this. You're working with a client with diabetes. You've taught them adaptive strategies for meal preparation, helped them organize their medication routines, and safely addressed how to cook in the kitchen with limited sensation related to diabetes. But after 3 months, their blood sugar or their A1C is still elevated, and the client's still struggling with stress eating, and they keep saying, I know what I should do, but I just can't stick with it. Does this sound familiar? As occupational therapists, we're trained to help people engage in meaningful activities and develop the skills they need for daily living. But what happens when knowledge isn't enough, when someone understands what they need to do but can't seem to follow through consistently? This is where health coaching comes in, and it's a natural extension of everything we already do as occupational therapy practitioners. So what is health coaching exactly? Let's start with the official definition. According to the National Board for Health and Wellness Coaching is a client-centered approach that engages clients in developing intrinsic motivation and attaining self-determined goals related to health and wellness. But what does that actually mean in practice? So health coaching is fundamentally about partnering with clients to help them discover their own solutions, build confidence in their ability to change, and create sustainable lifestyle modifications that support their health goals. Now, I know some of you are thinking, don't we already do that in OT? And you're absolutely right. There is significant overlap, but here's the key difference. In traditional OT, we often focus on teaching specific skills or providing compensatory strategies, but health coaching goes deeper into the why behind behavioral change. So let's break down the core elements. So first, it's client-centered and collaborative. So sometimes in OT, we have the opportunity to be client-centered and collaborative, and other times we have to use some more of our expertise. But in coaching, rather than being the expert who prescribes specific solutions, like how you might transfer, specific exercises you might do, or different assistive technologies you might want to try, you become a partner who helps the client discover what works for them. You're still bringing your clinical expertise, but you're just using it in a different way. Second, health coaching focuses on intrinsic motivation. So instead of telling someone that they should exercise or they should take their medicine because it's good for them, you can help them connect things like physical activity, taking medications, healthy eating to what they personally value. So maybe it's something like having the energy to play with grandchildren or feeling more confident in social situations. Third, health coaching addresses the whole person. So in occupational therapy, we might focus on specific occupational performance areas. But coaching looks at how things like nutrition, stress, sleep, relationship, and lifestyle factors all interconnect to impact health outcomes. Finally, health coaching is about sustainable change. Rather than short-term compliance, coaching aims to help people develop lasting habits and coping strategies that they can maintain in the long term. So why does health coaching matter to occupational therapy practitioners? Here's what the research tells us. Chronic disease accounts for just about 75% of deaths globally, and lifestyle factors, the things that our clients do every day, are the primary drivers of these conditions. We know that diabetes, heart disease, hypertension, and many other chronic conditions are largely preventable and manageable through lifestyle change. But traditional healthcare, including much of our OT intervention, often falls short of creating lasting behavior change. Think about your own caseload. How many clients with chronic conditions would benefit from better stress management, more consistent physical activity, improved nutrition, better sleep habits? Probably most of them. But fortunately, as occupational therapists, we're uniquely positioned to address these factors because we already understand the impact of daily routines and habits, how environment influences behavior, the importance of meaningful activity, client-centered collaborative approaches, and lastly, the complexity of human behavior and motivation. What health coaching adds to our toolkit is a systematic approach to behavior change that goes beyond education and skill building to address the underlying psychological and motivational factors that drive lasting change. So let's consider the difference between health coaching and traditional occupational therapy. Let's do a concrete example of how this might look different in practice. So a traditional occupational therapy approach for someone who has diabetes might include teaching them to better understand how to read food levels and understand sugar, and do some of the calculations around their mealtime activities, organizing their medication routines so they can make sure that they're taking their medications as prescribed, helping find adaptive kitchen tools that help with the sensation loss that they might be experiencing in their hands, or creating visual reminders for when to check their blood glucose monitor and things that they might be looking for. The health coaching approach, on the other hand, would include those things, but it would also explore what makes it hard to stick with healthy eating, what things motivate people to check their blood sugar consistently, even when it means a stick in the finger. How do people's relationships support or hinder their health goals? And what small changes feel the most manageable right now? We might also look at things like, what do they want in their life to be different? And how does diabetes management connect to that vision? The coaching approach isn't replacing our clinical skills, it's enhancing them with deeper attention to motivation, behavior change, and the client's own wisdom about what works for them. So in terms of staying with our OT scope, I know many of you are wondering, can I do this as an OT? And is this within our OT scope of practice? The answer is yes, when done appropriately. So health coaching, when integrated into occupational therapy practice, fits squarely in our scope because we are still addressing occupational performance and participation in meaningful activities. But it is crucial to understand the boundaries. So as OTs using coaching approaches, we are still not diagnosing medical conditions. We're not prescribing medications or supplements. We're not creating detailed meal plans or providing psychological therapy for mental health conditions. What we are doing is we're using coaching techniques to enhance our traditional OT interventions, addressing lifestyle factors that impact occupational performance, supporting health behavior change around health and wellness activities, empowering clients to self-manage their chronic conditions more effectively. The key is integration. We're not abandoning our OT identity, we're expanding our toolkit with evidence-based coaching methods that make our interventions more effective. So speaking of the evidence-based, let's talk a little bit about research. So studies consistently show that coaching interventions improve outcomes across multiple chronic conditions. For diabetes, coaching has been shown to improve A1C levels, medication adherence, and quality of life. For heart disease, coaching has been shown to reduce cardiovascular risk factors and improve self-management behaviors. The references to these studies I will be sure to put in the show notes. So what does this look like in different OT settings? So in outpatient settings, you might use coaching to help a client with arthritis, explore what motivates them to stay active rather than just teaching joint protection techniques. In home health, you could coach someone with COPD through developing a sustainable exercise routine that fits their energy levels and daily schedules. In mental health settings, coaching approaches can help clients with depression or anxiety build consistent self-care routines and stress management strategies. In private practice, health coaching can open entirely new revenue streams, allowing people to work with clients who don't traditionally qualify for OT services but want support in managing chronic conditions or improving overall wellness. And when we wear our coaching hat, we can benefit from the skills and our background as occupational therapists. The beauty is that coaching enhances whatever setting you're already working in. It doesn't require you to completely change your practice. It makes your existing practice more effective and also can open opportunities if you're interested in changing your practice or exploring different practice settings. So if you're intrigued by the possibility of integrating health coaching into your OT practice, here are some concrete next steps. First, educate yourself. So learn more about things where you feel like you could benefit from more knowledge. That might be things like healthy diet and exercise or medication management, or it could be skills like motivational interviewing. Consider becoming a board certified health coach. There are several approved programs, and if you join our mailing list, you will be one of the first people to know when our health coaching program becomes available, and it's going to be specifically for occupational therapy professionals. Second, start small. You don't need to completely overhaul your practice overnight. Begin by incorporating coaching techniques into your existing interventions. So ask more open-ended questions and think about what the client wants to achieve as opposed to what they should do. And take the opportunity to resist having your expert hat on and spending more time where you're partnering with the client on what they want. Finally, think about your ideal practice. Are you passionate about chronic disease management, mental health, health and wellness, aging well with the chronic disease? Health coaching can be applied across these areas or even other areas that we haven't considered yet, often allowing you to work with populations and issues that you're most excited about. So in this example, it's not about leaving occupational therapy. It's about expanding what's possible in our profession. So let's address some common concerns. So one common concern I often hear is I don't have time for longer sessions. So coaching doesn't necessarily mean longer sessions. It means more intentional sessions focused on what the client wants to achieve. Another concern is I'm not a mental health therapist. And you're right, coaching isn't therapy. It's a collaborative partnership focused on health and wellness goals, not treating mental health conditions. Another critique I hear is my workplace won't support this. And so the answer to that is start with small changes in how you interact with clients. As you see better outcomes, you can make a case for more formal coaching integration in your setting. Finally, the last critique I hear is I don't know enough about nutrition, exercise, stress management. And so you don't need to be an expert in every wellness area. Coaching is about helping clients find their own solutions and connecting them with appropriate resources when needed. So you don't need to know all the answers. You just have to be able to empower clients to find the answers they need to live healthy and productive lives. So as occupational therapists, we entered the profession because we believe in people's potential to live meaningful, satisfying lives despite health changes or challenges. Health coaching gives us an additional tool to make that belief a reality. The clients we work with, whether they have diabetes, heart disease, chronic pain, or any other condition, deserve more than just symptom management. They deserve to thrive. They deserve to feel empowered and confident in managing their health, and they deserve partners who believe in their ability to change and grow. Health coaching doesn't replace our clinical skills as occupational therapy practitioners. It amplifies them. It takes our natural strength in client-centered care, occupation-based intervention, and holistic thinking and gives us a systematic way to create lasting behavior change. If you're feeling called to expand your practice or to go deeper with chronic disease management or to help clients not just cope with their conditions but truly thrive, health coaching might be exactly what you're looking for. I'd love to hear from you about what aspects of health coaching you'd like me to dive deeper to in future episodes. Email me with your questions at Jaclyn, Jaclyn, at healthcoachot.com, whether you're curious about specific techniques or wondering how this applies to your practice setting, or you just want to know more about the certification process. Your questions help shape the content of this podcast. That's a wrap on today's episode of the Health Coach OT. If this resonated with you, hit subscribe on the Apple Podcast, Spotify, or wherever you listen and leave us a review. It helps other practitioners find the show. Ready to take the next steps? Visit healthcoachot.com to join our newsletter for weekly evidence-based coaching tips and get early access when our certification programs launch. Keep expanding what's possible in your practice, and I'll see you next week.